Welcome to the TED Community Organization Personal Story videos. My name is Christine Gustafson. I'm the Executive Director and CEO of the TED Community. Today we're talking with Susan Roberts, who is a TED patient, and she's got a fascinating TED story. So welcome, Susan. Thank you so much for joining us.
Thank you for having me. I'm pleased to be here.
Can you give us a little background about yourself? I mean, your life apart from TED, just a little so we get to know you.
I am a 60-something year old woman living in Maine. I've been married to my husband for 37 years. We have two children who are grown, and recently did move north to this home in Maine. We live in a log cabin on a little lake. And I am a currently retired pharmacist, licensed in Oklahoma and Maine.
Wow, I love the log cabin. It just looks like such a cozy place.
Thank you. It is very, very cozy.
Yeah, and a good place for storytelling. So, can you tell us, the viewer, when did your TED journey start? Like, what was it like right before you started noticing symptoms, and then take us into your TED experience?
Well, before I was working full time, my husband and I were empty nesters. We still are empty nesters, and we were looking forward to retirement. We had just purchased this home as a vacation home. We were living in Oklahoma, and we had purchased this home for a vacation home, and were contemplating what our retirement was going to be like and where we were going to be. We were just really enjoying life and looking forward to the future. In July of 2018, um, that's when I was diagnosed. I first started having symptoms several months before that, started with double vision. But what drew me to actually seek medical intervention was the eye symptoms of tearing and sun sensitivity. I Oklahoma is one of the top 10 worst states in the country for allergies, and I have seasonal allergies. And so I was attributing everything initially to seasonal allergies, um, except for the double vision. I couldn't really explain that away, but the tearing and the sun sensitivity, I thought it was really severe for allergies. And I was at my optometrist for an annual exam for new glasses and mentioned this to her. And she said, "Do you have any thyroid issues?" And I was actually in the process at the time with my primary care physician of being scheduled for Graves' diagnostic test. So I said, "Well, I might. I don't know for sure," but explained to her what was going on. And she said, "I think you might have thyroid eye disease." And I had never heard of thyroid eye disease. She's the one who said that those symptoms were pretty consistent with TED, and that maybe that was what was going on. She referred me to an ophthalmologist in her same practice, who actually did a couple of weeks later officially diagnosed me with thyroid eye disease. And that was right about the same time I got the official diagnosis of Graves as well. So at that point, then I started, trying to figure out what I was going to do next with thyroid eye disease. I wasn't given a lot of options at the ophthalmologist appointment. Basically, just high dose oral steroids or IV steroids or orbital radiation were pretty much all that was available to me at the time. So
What did they do to diagnose thyroid eye disease? What was the ophthalmologist like? What steps was that?
he basically did it on exam. and based on my symptoms and exam, I did not have any kind at that point. I hadn't had any kind of a CT or an MRI or any kind of diagnostic that way. He just did it by looking at me, and the changes in my eyes happened so gradually that I didn't really notice the appearance being that different. But when he looked at me and then he measured, I can't remember the name of the scope that they use that actually measures the bulging. And he said, "Oh, yeah, yeah." And then basically did the visual, where they ask you to follow your finger, and he could see that my eyes were not moving like they should and that they were becoming congested. And he said, "Well, I'm not surprised you have double vision because of the way your eyes are moving."
Hmm. Wow, that's so interesting. So when you're getting all these facts, there's another layer to this, which is the emotional experience. So what was that like?
Well, I was the doctor initially downplayed this so much to me that I left that office visit thinking this must not be much of a big deal, because he said, the good thing about thyroid eye disease, that is a quote. He said, the good thing about thyroid eye disease is you've got an active and an inactive phase, and you're going to eventually hit that inactive phase, and it won't get, it'll get, and when I heard inactive, I thought that meant that it was going to be gone. Inactive to me meant that I was going to not have to deal with this anymore. And I didn't even know what I didn't know when I left that. So I I just remember, kind of stumbling out to my car, and it was July. It was hot, blazing hot. The sun was super bright. And I remember just, kind of stumbling out to my car, getting in the car, trying to get out of the direct sunlight and sitting down and thinking, well, okay, I guess this is no big deal. And, this is going to be something I've just got to deal with for a little while, and then everything's going to be okay. He just really downplayed it as something that was not going to be that big of a problem.
Hmm. And then on the other side of it, you're diagnosed with Graves' disease, which these are two separate autoimmunes, but they tend to come together, almost like a
Right.
brother and sister. So,
Right. They are.
yeah. So, what was happening on the Graves side of it?
Well, on the Graves side, I had finally gotten a definitive diagnosis based on the thyroid scans and all of the things that they do. And I had started on methimazole, and I'd started on atenolol because I had the palpitations and the anxiety and all of the the really crazy things that go with Graves. I was my very good friend and I were training to walk a half marathon, and we were walking literally for hours and hours. And I told my doctor, I said, I'm doing all of this training, I'm walking, and my resting heart rate is going up. And that's what prompted him to start investigating whether or not I had Graves. And this all was happening at about the same time. So I was fortunate in that I was diagnosed with both of them within a relatively narrow time frame. So it was easier for us to try to get a handle on things.
Mhm. And do the two physicians eventually talk to each other, or is there like another physician that got involved?
Well, I don't believe that they did. I did see an endocrinologist. And then in the middle of all of this, we also moved from Oklahoma up to Maine full time. So when I got to Maine, I started a new job, and I was then had to completely reassemble a team of physicians for myself. And I had to wait for my insurance, and I had to wait for an appointment. And so I was diagnosed in July, started on methimazole shortly after that, and then moved in the middle of that and had a pretty significant lack of time, or I mean, a pretty significant window of time where I didn't have monitoring, which was a very bad idea. I didn't realize it at the time. I didn't know. I didn't even, again, I didn't know what I didn't know. But that I was overdosed on methimazole. It in my TSH was all over the place. It was a miserable, miserable time.
And doing one of the most high stress things you can do, which is moving.
Right. Moving and starting a new job. Yeah, it was
Yeah.
great.
Yeah. Oh gosh, that's a lot to go through. So where does the story even out to where you're thinking, okay, now things are getting dialed in, or does that never happen?
Well, I got the Graves, um I never got the Graves under control. The Graves became controlled when I had my thyroid removed. I would have wild swings in my TSH, and it was just it was not good. The anxiety and the problems that I was having were ridiculous, and my eyes were getting worse. I never really got to where where I thought an inactive phase was going to be, where I was not going to have symptoms. That never ever happened. So I was struggling with that, but then once I got a team assembled here, I got an ophthalmologist, I got an endocrinologist, I got a primary care physician, and then I got an ocular plastic surgeon, and that became my team up here. And once I got that in place, I felt like I had a pretty good handle on what I needed to do at that point.
Hmm. So, and then whose suggestion was it? Was it the endocrinologist that said, the medication is not getting the Graves under control?
Yeah,
Do
the
you think that?
endocrinologist started it, and that then he referred me to the thyroid surgeon.
Mhm.
So, and having my thyroid out really did change my life. It worked very well for me. I know it does not for everyone, but
Mhm.
it worked very well for me.
So that got the Graves under control. And then did it affect the thyroid eye disease or not so much since we know that they're so related, but separate?
Right. I didn't really understand that. I thought that it would help with the thyroid eye disease, and I don't really think that it did. It might have prevented it from getting worse, or I don't have a way to know for sure. But I did continue to struggle with symptoms and with flares past the time my thyroid was removed. So that was also an eye opener for me, is that they are separate trajectories, two different diseases, two different paths that are you're going to be going on for those. Even though they do walk together often, they do will converge on different paths sometimes.
Oh, so now as you're going through this, you've got your husband probably very supportive, but how is he being affected by, like bring the care partner into your story? How is he affected by what you're going through?
Well, he is the best cheerleader I could have ever hoped for. I had a very long argument with when I did get around of Tepezza eventually once it was approved on the market, but I had a very long fight with my insurance company. I had a hard time finding a provider in Maine at the time. This was at the height of the pandemic. I had a hard time finding a provider in Maine who would actually prescribe Tepezza. The one doctor that I contacted who was on the list of Tepezza providers during the pandemic was not accepting new patients. So I was sort of cast aside. I had to go down. I actually went down to Boston to a doctor there. And, but the problem with that was my insurance was not going to cover anything. There was not an insurance, initially, when Tepezza was approved, there was not an insurance company in the state of Maine that would say that they covered Tepezza.
Mm.
And so that became a big problem, of course, because nobody was going to pay for it. I was willing to change insurance companies, and I probably waited 9 months, um, trying to work with the people in Boston who were going to try to get me infused up here and just be seen down there. And they were working with me to try to get me on the free drug list because I couldn't find any coverage for it. And then I finally called my insurance company and I was told that Tepezza had become non-formulary instead of not covered, which means that I had to go through the whole approval process. And I had to get a doctor in Maine who was approved, who was in my network. So I basically started the whole process completely from scratch again to try and get Tepezza. But the ocular plastic surgeon I had had previous blepharoplasty because my eyes weren't closing. So he became a Tepezza provider, and I was able to go back to him and get Tepezza. This was about probably 8 to 9 months post my first surgeries with him. And then I did finally get Tepezza. So
And then did you get some relief? For people that don't know Tepezza, it's infusions. It's a biologic, and
right.
so it reduces the swelling behind your eyes, around and behind your eyes. Is that correct?
Right. It helps those muscles that have bulked up from the thyroid eye disease
Mhm.
to unbulk. And I actually had very good results with the Pezza, but for me, unfortunately, it was not a permanent result. I had 6 months of much improved vision, um, and then it failed sort of spectacularly. I had probably the worst flare I've ever had after about 8 months post Tepezza. And that's what eventually it prompted me to stop driving. And I also retired full time at that point because I was having so much trouble seeing. I couldn't drive myself to and from work, but I also, as a pharmacist, could not do my job. I just couldn't see well enough to do my job safely.
Mhm.
So at that point, I did retire.
Oh, so now tell us about again, the emotional part of it as you're going through that sounds like, you were like sailing kind of high because, wow, things are solved, the Graves' disease is under control now, or, just maybe non-existent. I don't know if you still have any kind of symptoms from Graves, but
Very few.
now, yeah. So,
Oh, no, I remember vividly waking up in our bedroom has logs running across the ceiling. And I have often looked up and seen two of each log. And I do remember vividly waking up one morning and seeing two of each log again on my ceiling and just being heartbroken. Just, it was back. Tepezza was not going to be a permanent solution for me. And I fought so long and so hard with my insurance company to get it covered that I was very, very, I was just, it was very disappointing, very disheartening. And I went back to to my ocular plastic surgeon and, he measured and he said, yeah, you're pretty much where you were before Tepezza. And that was before that was when I was having really the flare that, like I said, prompted me to stop driving and working.
mhm. So had you changed anything in your lifestyle? Are you like partying late at night, smoking cigarettes and all the things that are, just eating cakes all by yourself? I mean, was there something that you did that brought that on, or it's just that the efficacy of it just went only so far for you?
I think it was the efficacy of it. I really couldn't pinpoint anything. I am a walker. I do yoga. My husband and I eat a relatively healthy diet. We're not perfect, but I'm not a smoker. I'm not a drinker, not much of a drinker. And, you
Mhm.
know, I there really wasn't anything I could point to and say, oh, that might have been what caused it. There
Mhm.
was nothing. I think it was just the efficacy of Tepezza stopped for me.
Mhm. Oh gosh, what a thing to go through. So now, what's your next steps? How does your story continue to unfold?
Well, I decided when I realized that Tepezza had not worked long term for me, I was talking with the physician, the ocular plastic surgeon who had prescribed it, and he said, he said, we can try and get you a second round of Tepezza and see if that works. He said that I it'll be a battle. It was a battle to get the insurance company to pay for it the first time. I couldn't even imagine how difficult it would have been to have gone for a second round. And I also, at that point, that's when I initially found the TED community website, and I found the Ask TED option on there where I sent a question in asking about the percentage of patients who responded to a second round of Tepezza, what happened to them, and I got an answer from, I don't remember who it was, I wish I did, but an ophthalmologist who said that it looked like about a 60% chance that you would respond to a second time. And I thought, do I want to do a 60% chance to respond for another 6 months? Or I started to look into my surgical alternatives at that point, and I finally opted for orbital decompression on both eyes, and I've had just this year I had orbital decompression on my right eye first, and then my left eye. And then I had to have strabismus surgery after that to realign the muscles. But once the strabismus surgery was done, I am driving again. I'm not working again. I think I could. I just haven't really sought a position at this point. I'm pretty happy retired.
Mhm.
So I, I'm, I'm not really anxious to go back to work.
Mhm.
But
Well, I mean, it's almost like you
go,
need a vacation just from everything that you've gone through. That is quite a long journey with, so many twists and turns and highs and lows and just, yeah, it's a lot to go through. I mean, as you reflect on it, do you just, does it make you just think like, wow, I had no idea at the beginning that it would be like this? And how would you tell someone who's newly diagnosed, like what can you say to them?
well, that is a problem because I feel like I wish I had known a little bit, but there's a part of me that maybe is glad that I didn't, because had I known what a struggle it was going to be, I think I would have mentally had a much harder time. So I do try, when I talk to newly diagnosed patients, I try to um tell them that there is hope, which I would have liked to have known that what I had was not simple, and that it was not going to be something that was going to go away on its own, and but that there was hope. At the time, in defense of the ophthalmologist who diagnosed me, there really wasn't anything good out there much for a TED patient. All of the things that he offered, he said, well, it might work, it might work. And there was nothing that he said, this is really going to help.
Mhm.
So in his defense, I think he felt a little hopeless himself, but didn't want to disappoint me or alarm me at diagnosis, I think.
Mm. So you brought up the TED community. How has that been since you've been, I know that really participate greatly. So how has that been for you? And is that something that you would recommend?
It's a total and complete game changer. It is a lifeline to a TED patient, either newly diagnosed, especially newly diagnosed, but somebody like me who's been struggling since 2018 to finally be able to talk to other people who have walked the walk before. It's been wonderful. My story is not that different from many, many, many other TED patients. And I think just knowing that was huge for me, that I, you know, I have different twists and turns, but many of the same types of experiences and problems that all of the other TED patients have. And it's a lovely, lovely community with lovely people in it. And I am forever grateful to them for being there.
Does it surprise you how many like very bright and accomplished people get TED? You know, as you meet people in the community, and it's, you know, to me it's really eye-opening
It,
to
it's amazing. It really is. People who are professionals and just um, wonderful from all kinds of walks of life. It's very, very amazing. And like I said, it's a wonderful community.
So lastly, on this, like on this type of a topic, is that we have decided clearly by the need that quality of life takes such a dive when a person gets thyroid eye disease. And so we've been looking at areas where we might be able to provide some education and support, nutrition, anti-inflammatory, nutrition, movement as medicine, something that you would already be on board with,
Absolutely.
sleep hygiene, managing stress, things like that. But I know that you're keenly interested in that quality of life program. What is it about it that just, you know, like I see your eyes just light up when we talk about it. So why do you think that that is going to be an important part of what the TED community offers?
What I like about it is it empowers the patient to do something on their own outside of the medical community that would allow you to take back a little portion of your life. I just felt for so long like my life was consumed by this, and still in a lot of ways feel that. But if there's anything that I can do to be proactive and help myself along the way, I want to do it. And I want to know what's good to do. And I think that's what's so wonderful about the quality of life program is that that's going to help people do just that, give you back some of your power.
Mhm. It's interesting as I talk to different TED patients, the one through line for every story is, I want my life back. And
Yes,
it is that experience of your life just slipping away and just trying to grab a hold of it and pull it back, and but not having the tools to do so. It,
right.
you know, it's, I think, very important that we have the medical help. It's essential that we have the medical help, but it's not enough. That there has to be, like you said, you know, we want to participate in our own healing journey. And that is one way I think that can be, you know, very concrete way we can do it. So, and together.
And a clinician can't always address all those holistic needs of a patient. They just can't. They've got you for 15 or 20 minutes, and they can't address mental health concerns. They can't address diet, exercise, the kinds of things that you might be able to do to help yourself along. Whereas if there's an option for somebody to go and learn that on their own, it would be so wonderful.
Mm-hmm. Yeah. And with other TED patients.
Yes,
So,
yes,
yeah,
absolutely.
that's super. Do you have any parting, like any parting thoughts before we end? Really
What
appreciate you doing this.
What I wish I had known is that there I wish I had known, like I said, more about the disease itself. I never thyroid eye disease was not presented in pharmacy school even as a separate disease. It was all just lumped in as part of Graves' disease, which we studied in endocrinology. But there was never a separate thyroid eye disease diagnosed, or discussed in class at all. When I'd never heard of it until I was diagnosed with it, and I had gone through a professional program. So that, to me, I wish I had known a little bit more. I wish I had known what I didn't know. And at the time, I couldn't even Google very much about it. All I got was Graves' disease stuff. Um, Nothing specific to thyroid eye disease back in 2018 when I was diagnosed. So I I just now I would encourage people to know that there is hope, there is treatment, and that you can have your life back.
Mhm.
It might not be fun, it might be rough, but you can have your life back.
Hmm. Shooting for Ned, our
Ned,
little
yes.
NED, no evidence of disease. We'll just
Uh,
keep walking in that direction.
I want Ned.
Yeah. We'll find out if Ned is possible. Together, we'll find that out. So anyway, Susan, thank you so much. And for anybody who is interested in joining the TED community, there's no cost. There's an awful lot of free services. It's tedcommunity.org.
Come
Okay.
visit.
Yeah. Thank you so much.
Thank you.